hyperprolactinemia versus premature ovarian failure, POF, POI, so you have enough material for exams or notes. 1. Definition: hyperprolactinemia, a condition where there is abnormally high prolactin in the blood, 25 nanograms per milliliters in women. Prolactin is secreted by the anterior pituitary and normally regulates lactation and suppresses ovulation. POF, POI, defined as loss of normal ovarian function before the age of 40, characterized by amenorrhea, hypoestrogenism, and elevated gonadotropins. 2. Causes: hyperprolactinemia, pituitary adenomas, prolactinoma, hypothalamic diseases, hypothyroidism, TRH stimulates prolactin, medications, antipsychotic, antidepressants, antihypertensives, stress, chest wall injury, or idiopathic. POI, genetic, Turner syndrome, Fragile X premutation. Autoimmune ovarian failure, iatrogenic, chemotherapy, radiotherapy, pelvic surgery, viral infections, mumps, oophouritis, idiopathic, most cases. Header 3, hormonal abnormality, hyperprolactinemia, high prolactin levels suppress hypothalamic GnRH, FSH, and LH, decreased ovarian stimulation. POF, ovarian follicles are depleted or resistant, no estrogen production, loss of negative feedback, markedly FSH and LH. 4. Estrogen status, hyperprolactinemia. Estrogen may be normal or mildly reduced, depending on severity and chronicity. Estrogen is markedly decreased. Hypoestrogenism is a hallmark. Hasher 5, gonadotropins, FSH and LH. Hyperprolactinemia, normal or reduced due to suppression of GnRH. Elevated, SH find 40 IU and prela, LH also high. This, ovarian reserve, hyperprolactinemia. Ovarian follicles are intact and functional. Fertility returns when prolactin is normalized. POF, ovarian follicles are depleted or non-functional, leading to permanent infertility in most cases. 7. Menstrual pattern, hyperprolactinemia, oligomenorrhea or secondary amenorrhea, usually reversible. Persistent amenorrhea, primary or secondary, usually irreversible. 8. Galactorrhea, hyperprolactinemia, common symptom due to prolactin's effect on mammary glands. Absent, not related to prolactin. Fertility potential, hyperprolactinemia, fertility is impaired but usually restored with treatment. POF, fertility is severely compromised, spontaneous conception is rare, 5 to 10%, often requiring oocyte donation. 10 associated symptoms, hyperprolactinemia, galactorrhea, infertility, headaches and visual field defects if pituitary adenoma, reduced libido, POF, hot flashes, night sweats, vaginal dryness and dyspareunia, irritability, depression, long-term complications, osteoporosis, cardiovascular disease. 11. Bone health, hyperprolactinemia, usually preserved unless prolonged hypoestrogenism develops. POF, severely affected, high risk of osteoporosis and fractures due to estrogen deficiency. 12. Diagnosis, hyperprolactinemia, serum prolactin, TSH to rule out hypothyroidism, MRI pituitary for prolactinoma. POF, elevated FSH, 40 IU per letter on 2 separate occasions. Low estradiol, karyotyping Turner's Fragile X, autoimmune antibody testing. Hair 13 treatment, hyperprolactinemia, dopamine agonists, bromocriptine, cabergoline. Surgery, radiotherapy if large prolactinoma. Correct underlying cause, thyroid replacement in hypothyroidism, change drugs if culprit. POF, hormone replacement therapy, estrogen plus progesterone, calcium and vitamin D for bone protection. Fertility counseling, assisted reproductive techniques, oocyte donation. 14. Reversibility, hyperprolactinemia, usually reversible with treatment, normal cycles and fertility can return. POF, usually irreversible, once ovarian reserve is depleted, cannot be restored. 15. Prognosis, hyperprolactinemia, good prognosis. Most women regain normal menstrual cycles and fertility after treatment. Poor prognosis for fertility, lifelong HRT needed for symptom control and prevention of complications. In short, hyperprolactinemia is a pituitary problem suppressing ovarian function, reversible. POF is a true ovarian failure with follicle depletion, irreversible. Thank you. Have a nice day.